Hello, my name is Ida Thomas and I'm the chair of the Chronic Disease Prevention Alliance of Canada, where I represent YMCA Canada as one of the Alliance members. On September 19th and 20th, I had the opportunity and the great honor of representing the Alliance at the United Nations Summit on Non-Communicable Diseases in New York City. I was invited to join the Chief Public Health Officer of Canada, Dr. David Butler-Jones, and the Minister of Health, the Honourable Leona Aglukkaq, as well as a number of experts. The summit brought together all members of the United Nations to consider one question: how can we work both as individual nations and together to take urgent action against the chronic growing threat of chronic disease? Chronic diseases like cancer, diabetes, heart disease, and respiratory illness take a terrible toll on people around the world, killing about 36 million people each year. Many millions of other people live with these diseases. Many cannot work or participate fully in society because of their chronic illness. Chronic diseases also take a terrible toll in Canada. 3 out of every 5 Canadians over 20 years of age have a chronic disease. The numbers are even more striking for older people and for Indigenous and Northern populations. Every year, approximately 2/3 of all deaths in Canada are caused by chronic diseases. According to the Public Health Agency of Canada, these diseases cost our economy at least $190 billion each year. An estimated 80% of premature heart disease, stroke, and type 2 diabetes, and 40% of cancer can be prevented through healthy diet, regular physical activity, and staying away from tobacco products. So why have 16 million Canadians developed a chronic disease? And what can we do to stop the trend? The Chronic Disease Prevention Alliance of Canada is a partnership of 8 national groups working together to prevent and reduce chronic disease. A major part of the Alliance's mandate is to identify, develop, and mobilize evidence and best practices for chronic disease prevention. With that knowledge, we work primarily at the federal level to influence government policies and practices. Members of the Alliance have a collective vision of a Canada in which people are supported by a comprehensive, sufficiently resourced, sustainable, and integrated system of research, surveillance, policies, and programs for maintaining health and the prevention of chronic disease. Our goal is to tackle the risk factors that are common to chronic disease, such as tobacco, poor eating habits, and physical inactivity. At our conference in Ottawa in February 2012, we will continue our work to foster and help sustain a countrywide movement towards an integrated population health approach for the prevention of chronic disease through the mobilization of evidence and best practices. We'll take stock of the advances that have been made in prevention in Canada, the successes, the challenges, the gaps, and the opportunities. In recognition of the multifactorial causes of chronic disease, the emphasis will be upon what works, in terms of how sectors are coming together for collaborative action on chronic disease prevention. Chronic diseases are caused by a wide range of factors, many of which are outside those we traditionally think of as health-related. Our income, our level of education, the environments where we live, learn, work, and play, all have an impact on our health status. Therefore, only a whole-of-society approach, dealing with a broad range of determinants of health, will have a positive impact on the health of Canadians. At the conference, we will again profile the Alliance's framework for action as we feel it offers a very sound approach for orchestrating integrated action on chronic disease prevention. The international focus on chronic disease stemming from the UN Summit provides a tremendous opportunity for every Canadian to learn about chronic diseases and how to prevent them. It also provides a catalyst for concerted and collaborative action for every sector and every region of Canada. Please join us as we move forward on this journey to change the future of the health of Canadians. Come participate in our conference, share your views with us, and together we will make a difference.